Good morning, all. So today I'm going to talk about the respiratory system. This will be the first part of the lecture. These will probably go up in 2 or 3 parts, just because of the length of the lecture, and sort of trying to keep each video to about 30 to 45 minutes. So I'm going to pull up the PowerPoint presentation here, and what you can see is hopefully the presentation, and just follow along as I go. So one of the main functions of the respiratory system is respiration. This involves both the respiratory and circulatory systems because the respiratory system's job is to get the respiratory gases of oxygen and CO2 into the body and exchanged into the blood. And the job of the circulatory system is to actually transport those gases around the body. Now, there are 4 processes that will supply the body with oxygen and subsequently also dispose of CO2. The first process is what we call pulmonary ventilation. Pulmonary ventilation is the actual physical process of moving air into and out of the lungs. And this is an integral part of the respiratory system. The second is respiration. Respiration is gas exchange. And there are 2 types of respiration. We have external respiration, and this is where the oxygen in the atmosphere will actually enter into the alveoli of the lungs and cross across the alveoli membrane and enter into the blood. Carbon dioxide will leave the blood and then cross across the alveoli membrane and exit out through the lungs. And again, external respiration is going to be part of the respiratory system. Then we get transport, and the transport is what the circulatory system's job is. And that will transport oxygen and CO2 throughout the body. Now what happens is at the level of the tissues, you're going to get another type of respiration. Again, respiration is gas exchange. And in this respect, the internal respiration is going to be oxygen now leaving the blood, crossing through the capillary membrane, going to the tissues, and now CO2 will leave the tissues, cross the capillary membrane, and go back into the blood to be transported back to the lungs. And the whole cycle will continue over again. Now, looking at the respiratory system, the major organs involved, we have the nose, the nasal cavity, paranasal sinuses. This is all in that whole, nasopharyngeal area within the skull there. Then you have the pharynx, and we'll talk about the pharynx in a minute. The larynx, trachea, bronchi. The trachea will actually branch off into 2 bronchi, primary bronchi, right and left, each one going to a lung. And then you'll continuously start to see what we refer to as the bronchial tree, where the bronchi will continuously branch. This branching will actually occur in a magnitude of 23 different orders. And then you'll get to the actual lungs, where you will find the alveoli, which are the air sacs that are bundled together. And these are essentially going to be where gas exchange occurs. So here's the general anatomy for the respiratory system, okay? And what you can see here is, we have our nasal cavity right here. You have the oral cavity. I do want to mention something here is that when you breathe, you should actually be breathing through your nose, okay, not your mouth. And I know a lot of people tend to be mouth breathers, but you really should be breathing through your nose. The reason for this is the actual nasal cavity here. What this allows for is moistening and warming of the air. So essentially the air has to be humidified, and it has to be humidified before it gets to the alveoli. The reason why we humidify the air is that allows for much better gas exchange across the respiratory membrane there. Now the pharynx will actually extend from the back end of the nasal cavity all the way past the oral down through the oral cavity and then into the throat. And the pharynx actually has three distinct regions. This region right around here would be the nasopharynx. Then we have the oropharynx, and then we would have the laryngopharynx. The pharynx will be continuous with the trachea, and this is your windpipe. This is actually formed from cartilage rings, and this is a patent airway. Patent airway means that it remains open. It's like it almost looks like a little flexi straw. And before we broke, we actually looked at this in our cat dissections, and many of you actually saw the trachea there. The trachea will then split into primary bronchi, and the primary bronchi will feed each lung. Okay. Now the left lung is going to have 2 lobes. The right lung will have 3 lobes. And the left lung is going to be slightly a bit smaller. And the reason why the left lung is slightly a bit smaller is because if you look right here, we can see that there's actually going to be something else sort of taking up a little bit of space there. And that something else is actually the heart. Okay. Both lungs will actually sit on top of the diaphragm here. Okay. And the base of the lungs will actually rest right there. Now, when we look at the anatomy, okay, we have 2 different types of functional anatomy. We have what's called the respiratory zone. The respiratory zone is the site of gas exchange. This is the areas of the respiratory system particularly involved with actually exchanging gases, okay? The conducting zone, this is sort of the network of conduits to get the air to the respiratory zone, okay? If you sort of think about this, this would sort of be like, you know, the ductwork going through your house to deliver the air to a particular area. So the conducting zone's function is to get the air to where it needs to be. The respiratory muscles will include the diaphragm, as well as your intercostal muscles. You have internal and external intercostals, and they'll both play a role in breathing. However, the primary muscle involved in breathing is going to be the diaphragm. If you have paralysis of the diaphragm, you will not be able to breathe. This muscle is absolutely necessary and must be active for breathing to occur. Okay, so let's look at the nose. In case you didn't know where your nose was, hopefully you'll familiarize yourself with it. The functions of the nose is that it provides an airway for respiration. It moistens and warms the entering air. It will help to filter and clean the inspired air because you are inhaling various particles which may not want to necessarily get down into the lungs. It also serves as a resonating chamber for speech, and it houses all olfactory receptors. Now, looking at the nose structurally, there are 2 regions. We have what's called the external nose. This is the portion that you can see on the outside of the face, okay? And in case you didn't know where your nose was, here's your nose, all right? And here's a cartoon of where your nose is. Then we also have the nasal cavity. This is where a lot of the activity is actually taking place. The nasal cavity is going to be divided by a midline nasal septum. You will have posterior nasal apertures. These are the openings into the nasal pharynx. The roof of the nose is formed from the ethmoid and sphenoid bones. And the floor is actually formed from the hard and soft palates of the hard and soft palates. The vestibule of the nasal cavity is going to essentially allow for the filtration of coarse particles that are coming in from the inspired air. The olfactory mucosa will line the superior nasal cavity, and it will also contain smell receptors. The olfactory mucosa is very important because this is where you're going to get that warming of the air, okay? The mucosa is also lined with mucus, and that will help to trap a lot of particles. And again, you want to try and minimize what gets down into the lungs. Okay, so the respiratory mucosa, this is going to be composed up of pseudostratified ciliated columnar epithelium. And this might require you to actually go back to chapter 4 and look at what this actually is. But pseudostratified is an epithelium that looks like it has multiple layers, okay? But it actually is only a single layer. The mucus and serous secretions will contain lysozyme and defensins. These are chemicals that are produced by your own mucosa that actually help to control microbial growth. The nasal passageway and the respiratory system is an entry point for various microorganisms to enter into the body, as we are fully aware with what's currently going on. Cilia will move contaminated mucus posteriorly to the throat. Inspired air will then be warmed by plexuses of capillaries. So it's the actual blood vessels that are going to help to warm the air, okay, as well as the veins that are present there. And then sensory nerve endings will trigger any sneezing. Okay. So now looking here, we can see a better view of the nasal cavity here. So air would come into here, and you can see this is actually a pretty large surface area. And again, this is lined with mucosal membranes and blood vessels, and you actually have these nasal concha, which you probably learned in A&P1 when you did the skull. And the purpose of this nasal concha is that it actually increases surface area, which allows for more air to be humidified. Okay. So the nasal cavity is formed by the superior, middle, and inferior nasal concha. These will protrude from the lateral walls, and as I just mentioned, they will help to increase the mucosal surface area. They also help to enhance air turbulence. Now, the functions of the nasal mucosa and the concha. During inhalation, the concha and the nasal mucosa will filter, heat, and moisten the air. During exhalation, these structures will then reclaim heat and the moisture. Okay. Now, you also have paranasal sinuses, and if you are somebody that unfortunately suffers through sinus infections, you know exactly where these sinuses are located. And again, this is probably something that was covered with the skull in A&P1, but we have frontal, sphenoid, ethmoid, and maxillary sinuses, okay, and they're located in those respective bones. The purpose of these sinuses is that they help to lighten the skull and help to warm and moisten the air. The pharynx, this is a muscular tube that will connect the nasal cavity and the mouth superiorly, and the larynx and the esophagus inferiorly. The larynx will be continuous with the trachea. So the pharynx is actually going to be a shared tube between the respiratory and the digestive systems. However, the part that's up behind the nasal cavity, the nasopharynx, that is strictly for respiratory functions. And again, if we look here in this image, we can see the three distinct zones of the pharynx. We have the nasopharynx, the oropharynx, and then the laryngopharynx. Okay. The nasopharynx, this will just be for respiratory. The oro and laryngopharynx, this will be shared between the respiratory and digestive systems. So looking a little more specifically, the nasopharynx is an air passageway that's posterior to the nasal cavity. The lining is going to be pseudostratified columnar epithelium. The soft palate in the uvula will close the nasopharynx during swallowing. This is so that when you swallow, food and beverage actually does not go up into your nose. And sometimes if you're laughing and you're drinking, or you sort of take that breath of air in when you're drinking, you'll actually sometimes get this to come up your nose. Now, looking at the lining, it's pseudostratified columnar epithelium. This is a single layer of epithelium. This is not lining that you can have fluids or food going through, okay? When we actually look at the oral pharynx, the lining now has changed from pseudostratified to stratified squamous epithelium. And the reason why you're seeing multiple layers of cells now is because with the stratified squamous epithelium, this is now a shared structure with the digestive tract. And when you eat things like Doritos, which can be quite harsh when you swallow, they're going to scratch the throat there a little bit, okay? And you want to have a much more beefed up, quote unquote, epithelial lining. The oropharynx will, the isthmus of the fauces, this is the opening to the oral cavity. The palatine tonsils are located in the lateral walls, and the lingual tonsils are on the posterior surface of the tongue. The laryngopharynx, this is the third part. This is also a passageway for food and air. Posterior to the upright epiglottis, and it extends to the larynx where it is also continuous with the esophagus, okay? And again, right here, we have the nasopharynx, oropharynx, and then the laryngopharynx. The larynx, this will attach the hyoid bone, and it will open to the laryngopharynx. It is continuous with the trachea, and it functions to provide a patent airway, routes air and food into proper channels, and it's also involved in voice production. The cartilage rings of the larynx, we have several different rings or several different pieces of cartilage that will actually comprise the larynx. You have hyaline cartilage, is what most of this cartilage will actually be composed of, except for the epiglottis. The epiglottis is actually going to be elastic cartilage. The thyroid cartilage, which is hyaline, this will form the laryngeal prominence, which is often referred to as the Adam's apple. You will then have a ring-shaped cricoid cartilage, paired arytenoid, cuneiform, and corniculate cartilages. And again, these structures, thyroid cartilage, cricoid, arytenoid, cuneiform, and corniculate cartilages, all form the structure of the larynx. The epiglottis, this is actually going to be made up of elastic cartilage, and this covers the laryngeal inlet during the process of swallowing. And here you can see the structure of the larynx and the epiglottis right there. Again, everything in blue is going to be hyaline cartilage. Now, the larynx, this is your vocal ligaments. They will attach the arytenoid cartilages to the thyroid cartilage. They contain elastic fibers, and they will form the core of the vocal folds, which are referred to as your true vocal cords. There is an opening between them and the glottis. What happens is as air passes through, sound will actually rush up from the lungs, and you produce voice or sound. The vestibular folds, these are the false vocal cords. They actually are there to really just help the glottis during swallowing, and they actually serve absolutely no use in sound production. Okay, and the things in white right here, these are your true vocal cords. And then right here on the either side, these would be your false vocal cords. Okay, and you can sort of look at the different parameters for voice production here. The vocal folds may also act as a sphincter to help prevent air passage. For example, Valsalva's maneuver. This is, for example, when you're bending over to pick up something that's very heavy, and you sort of are holding your breath in and sort of building up that intra-abdominal pressure. Your abdominal muscles will contract, that pressure will rise, and this will actually help stabilize the trunk during heavy lifting. Okay, the trachea. This is your windpipe. It will go from the larynx into the mediastinum. The wall of the trachea is formed from 3 different layers: mucosa, which is ciliated pseudostratified epithelium. And that pseudostratified epithelium will contain goblet cells, a submucosa, which is connective tissue, and a seromucous glands, and then an adventitia, which is just sort of an outer connective tissue covering. The trachea will also contain the trachealis muscle. This will connect the posterior parts of the cartilage rings. And when you cough, it's actually the trachealis muscle that will help to expel mucus. The carina is actually the last and final tracheal cartilage, and it's the point at which the trachea will then branch into the two primary bronchi, one going to each lung at that point. Now, what you're looking at here, this is actually a cross section. Here's the trachea. You can see the tracheal rings. Again, this is a patent structure, which means that it is kept open by the actual structure of the cartilage. You can also see the mucosal lining here, and you can see actually cilia lining that mucosal structure. Posterior to the trachea, you will have the esophagus. Now, the esophagus is oftentimes a flattened structure, and it remains collapsed for most periods of time, except when food is sort of passing through it. And this is just looking at a histology slide. Here you can see the cartilage, the hyaline cartilage, so this would be the cartilage ring. We have the submucosal structure, and then here's the pseudostratified epithelium that is ciliated. The bronchi and the subdivisions of the bronchi, air passageways will actually undergo 23 orders of branching, and the branching pattern will be called the bronchial or the respiratory tree. Okay, so essentially what we have with the conducting zone is the trachea will branch into the right and left main primary bronchi. Each main bronchus will enter the hilum of one lung. The right main bronchus is wider, shorter, and more vertical than the left. And then what will happen is each main bronchus will branch into what we call lobular or secondary bronchi. And each one of the lobular bronchi will feed into a lobe of the lung. And as I mentioned previously, the right lung is going to have 3 lobes, so we'll have 3 secondary bronchi. The left lung will have 2 lobes, and that will have 2 secondary bronchi. Each secondary bronchi will then branch into segmental or tertiary, and then this is where you start to get those orders of division, and it will continuously branch and continuously branch and continuously branch until you get to the terminal bronchioles, which are the smallest, less than 0.5 millimeters in diameter. And looking at this little diagram here, you can see the trachea. This would be the carina, splits into the primary bronchi. Here you can see the primary bronchi going into each lobe, splitting into secondary bronchi, one here, and one here. And here you have one and then one. Okay, and you can see the continuously branching from there on. So with the conducting, continuing with the conducting zones, from the bronchi through the bronchioles, the structural changes will eventually start to occur. Cartilage rings will give way to plates. Cartilage is going to actually be absent in the bronchioles. And what you will start to see is the epithelium will change from pseudostratified columnar to cuboidal. And as you get deeper into the bronchial tree, the goblet cells will become less sparse because you don't want a lot of mucus building up there. And also the cilia will start to fade out. The relative amount of smooth muscle will now increase, and what this allows for is the amount of air, essentially regulating the amount of air that can enter or exit, enter or exit the alveoli. Okay. So the respiratory zone, this is actually going to include the respiratory bronchioles, the alveolar ducts, the alveolar sacs, which are the actual clusters of alveoli. Each lung will actually contain approximately 300 million alveoli. And this will actually account for most of the volume of the lungs. Okay, and again, the alveoli is going to be the primary site for gas exchange. Looking here, you can see the terminal bronchioles. What you do see here is a lot of smooth muscle sort of surrounding that. And you can see each of the terminal bronchioles is sort of feeding into what we call an alveolar sac. An alveolar sac is going to be a bundle of alveoli. And again, these are like little balloons that essentially will inflate and then deflate. Looking at the alveolar sacs, one thing that I want to point out here is the alveolar pores. These are actually holes that are open between each of the alveoli. And what this allows for is as air fills into one, it can then move into the next and then so on and so forth. It's sort of like if you've seen the new versions of bubble wrap where when you push on a bubble to try and pop it, it doesn't pop anymore because the manufacturers have put little holes or openings between each of the bubbles. So when you push on a bubble, it actually now goes into the remaining bubbles, taking away all the fun of bubble wrap. Okay, just hold on one second. Okay, so the respiratory membrane is actually a very thin structure. It is about 0.5 microns. A micron is 1/1,000,000th of a meter thick. The alveolar and capillary walls and their fused basement membrane is what forms up the respiratory membrane. And what you will have are scattered type 2 cells. These type 2 cells are going to help secrete surfactant. Surfactant is actually a detergent that will help to prevent the alveoli from collapsing. And looking here, again, this is sort of blown up a little bit bigger. We can see the smooth muscle surrounding each of the bronchioles. This is smooth muscle. The air would come into here, and if you look, each one of the air sacs is actually surrounded by a capillary. And that capillary will actually be where the site of gas exchange occurs. Okay, and here's an electron micrograph looking at alveoli and the capillaries surrounding them. So alveoli are surrounded by fine elastic fibers. They contain pores that are going to connect to adjacent alveoli, and these pores will allow air pressure throughout the lung to be equalized. This will also house alveolar macrophages that will help to keep the alveolar surfaces sterile. And looking here, this is sort of a little cartoon looking at the respiratory membrane. So essentially what you have here is, this is the alveoli. This would be the inside of the alveoli, so looking right here. You see the wall of the alveoli, but then you see a capillary that's here, okay, in the wall of the capillary. And what's going to happen is oxygen is going to leave the alveoli, cross into the capillary. CO2 is going to leave the capillary and cross into the alveoli. Okay, the lungs. They occupy all of the thoracic cavity except the mediastinum. The root of the lung is a site of vascular and bronchial attachments. The costal surface is found on the anterior, lateral, and posterior surfaces. And it's called the costal surface because it's actually in contact with the ribs. And here you can sort of see a cross-section looking at the lungs there. The apex of the lungs is a superior tip. The base is at the bottom, and this is what's actually going to sit on the diaphragm. The hilum, as you guys saw when we dissected the cats, the hilum is the point of entry for the bronchioles. The primary bronchi, the blood vessels going into the lung. Okay, it's just a point of attachment where most of these structures will enter in. The left lung does have a cardiac notch, which allows for the heart. Okay. As I mentioned, the left lung is smaller. It is separated into 2 lobes by an oblique fissure. The right lung has 3 lobes, separated by an oblique and horizontal fissures. The bronchial pulmonary segments, there are 10 segments in the right lung and 8 to 9 in the left. Okay, and here's actually a nice little picture that kind of shows you the bronchial tree. And if you've ever been to Body World, you've probably seen something very similar to this. Blood supply. Pulmonary circulation is pretty low pressure, high volume. The pulmonary arteries will deliver systemic venous blood flow. They will branch profusely along with the bronchi. They will feed into the pulmonary capillary networks. The pulmonary veins will carry oxygenated blood from the respiratory zones to the heart. With systemic pressure, the bronchial arteries will provide oxygenated blood to the lung tissue. Now, with systemic circulation, this is different than pulmonary circulation. This is the part at which arteries are now feeding the lung tissue. Okay, remember we talked about this with the heart. You have blood passing through the heart for its job, but then you also have the arteries that are actually supplying the heart itself. The pleura, this is a thin double-layered serosa. Parietal pleura on the thoracic wall and superior face of the diaphragm. The visceral pleura is on the external lung surface, and you have fluid between the two. This provides for a friction-free surface so that the lungs can expand out and contract. Okay, and this is where I'm going to stop for the first recording, because this is where we will end with all of the anatomical structures. Oops.